Let's talk about a single word, the word minor. It sounds harmless, right? But what if I told you that when it's attached to traumatic brain injury, it might be one of the most dangerously misleading words in all of medicine? Yeah, that's the big question we're tackling today. We're going to dig into this strange paradox, how an injury that sounds so small can actually have huge, life-altering consequences that are anything but minor. In fact, there's a reason experts have called this the silent epidemic. This isn't just a handful of unlucky cases we're talking about. It's a massive, widespread issue that flies under the radar, leaving millions of people to struggle through their recovery completely on their own. Okay, so let's really get into this paradox. Why on earth would we label an injury with such serious potential as minor to begin with? It seems crazy, right? Well, it all comes down to where that word minor comes from. In the emergency room, minor or mild is just a label for the initial event. Did you lose consciousness? If so, for how long? It's a snapshot of that moment. What it does not do is predict anything about the long-term symptoms or how tough the recovery is going to be. Here's the official definition, and the words that should really jump out at you are physiological disruption of brain function. That's the core of it. And notice, it even says it may or may not involve losing consciousness. So you can be wide awake the whole time and still have a traumatic brain injury. And the scale of this is just wow. Get this, up to 2 million people in the US alone might get a concussion every year and never even set foot in an ER. Think about that. That's a huge number of people just trying to cope with the aftermath, totally off the grid. So clearly, with numbers that big, our everyday understanding of this stuff is, well, it's just wrong. So let's start by busting the first big myth, the idea that this is just a simple bump on the head. We tend to think, oh, I bumped my head, I got a bruise, but the reality is way more complicated. The real action, the real damage, isn't happening on the outside. It's all about what's happening to the brain inside the skull. And here's the wild part. You don't even need a direct hit. The sudden stop and start forces from something like whiplash in a car accident are enough. Your brain, which is soft, slams around inside your hard skull. This stretches and tears microscopic nerve fibers, called axons. That damage then sets off a whole chemical mess in the brain and can even mess with the blood-brain barrier, which is supposed to protect it. It is a serious, complex event. Now, because all this damage is happening on a microscopic level, it leads us to the next big and honestly really frustrating myth for patients. The idea that a brain scan will tell you everything you need to know. You can just imagine this, right? You feel awful, your head hurts, you can't concentrate, you just don't feel like yourself. But the doctor comes back and says, good news, your MRI is clean. It can be incredibly confusing and invalidating. But the reason is simple. Standard MRIs and CAT scans are looking for big things, like a brain bleed or skull fracture. They are completely blind to that microscopic axonal damage we were just talking about. And that's why this quote from the source material is so perfect. It really gets to the heart of the problem. Just because our current medical tools can't see the injury, it absolutely does not mean the injury isn't there. For the person living with it, the symptoms are 100% real. And what are those real symptoms? Well, they're the invisible wounds a scan will never pick up. Physically, you're talking about things like constant headaches, a sense of dizziness, or a deep fatigue that never seems to lift. Cognitively, it's a new, frustrating world of memory problems, feeling like your thinking is stuck in slow motion, or just not being able to focus. And emotionally, the toll can be huge, leading to irritability, anxiety, and even depression. So because these symptoms are invisible, it feeds into the third myth, and this one might be the most damaging of all. The myth of a quick recovery. We've all heard it, and maybe we've even said it. Oh, just take it easy for a couple weeks. You'll be back to normal. But for so many people, that's just a fantasy. The brain is the most complex thing in the universe. It doesn't heal on a neat little schedule. Recovery isn't an event. It's a process. It's a journey. So let's look at what that journey really looks like, based on the data. For the first 1 to 3 months, yeah, the brain is working hard to heal, but a ton of symptoms are still hanging around. In fact, at the 3-month mark, somewhere between 30 and 50% of people are still dealing with issues. And while most do get better over the next year, the key thing to see here is that for some, those problems can last a lot longer. Let's put some hard numbers to that. Look at this. 3 months after the injury, a full 40% of patients are still symptomatic. And even a whole year later, about 15%, that's more than 1 in 10, are still struggling. So this idea that everyone just bounces back quickly, for a significant number of people, it's just a myth. Okay, so we've torn down the myths. Let's build up the reality. What does an actual effective recovery look like? If the old way doesn't work, what does? The single biggest shift in thinking has to be this. Good treatment stops focusing only on the initial injury and starts focusing on a person's real life. How are these invisible symptoms affecting their job, their relationships, their ability to just get through a normal day? That's what matters. And this is the roadmap for that kind of recovery. It starts with a super comprehensive evaluation, one that goes way beyond a simple brain scan. Then you need a whole team, neurologists, therapists, psychologists, all talking to each other. The treatment itself has to be laser-focused on getting back real-world abilities, and it absolutely has to be tailored to each person. No cookie-cutter programs. And this last quote, man, it really gets to the human side of this. Just imagine being that patient. You have to tell your story over and over again, to doctors, to your family, to your boss, and some of them just don't get it. Or worse, don't believe you. It's exhausting, and it actually makes it harder to heal. The very first step to helping someone recover is believing them. Which really brings it all back home, to us. Now that we've pulled back the curtain on this deceptive diagnosis, the real question is for all of us. Knowing what we know now, how can we be better? How can we offer real understanding and real support for the millions of people who are walking this incredibly difficult and visible road to recovery?